Hello, I'm Dr. Cohen. As you all know from being at this website, I'm a board-certified plastic surgeon. In this segment, I'd like to talk a little bit about those products and things that we offer in our medical spa. I have a medical spa both here in the United States, in Rockville and McLean under the name of Papillon, and in fact in the United Kingdom, in London right now, with more to come under the name of Beyond Medi Spa, which is located in Harvey Nichols and Knightsbridge. Our medical spas are the same, and they basically have the same philosophy. Our goal is to offer non-invasive procedures to people who either aren't ready for plastic surgery or who will never want plastic surgery, but who are in fact looking for improvements in their skin beyond what skincare can do. That does not mean to say that skincare should be omitted. I think, as I've said in an earlier segment, that skincare is critical for everybody, from the youngest person for sunblock and antioxidants up to somebody who has a lot of fine lines and wrinkles who is using more sophisticated skincare such as glycolics, retin-A, and perhaps even prescriptive skincare. But when I started practice approximately 18 years ago, there was a huge void when you used to jump from basic skincare that you would get in, let's say, Nordstrom's or in Macy's, which was mostly oil and water and a lot of media hype, to plastic surgery and nothing in between. And that void has been rapidly filled over the last few years. The void for non-invasive or minimally invasive aesthetics is now commonly found in places that we refer to as medical spas. A spa is a place where you think of going to relax, and you combine that with a little bit of medicine, and hopefully you're going to have a relaxing environment where you can go and find pretty quick fixes, if you will, for improvement, subtle improvements, and sometimes not so subtle improvements of both facial and body problems. It's very important to know that there are many procedures out there which are flashes to the pan. What I mean by that is things that either don't work or things that don't work very well, and even more so things that aren't tested. One of the things that define my medical spas and my concepts, both here and in the UK, is that we won't offer to you if, number one, we won't offer to our family members, and number two, if it's not significantly clinically tested. It's very important to distinguish between those things which truly have clinical efficacy and foundation and has been tested significantly, i.e. on hundreds or if not thousands of people over time. Because what little known fact is out there is that it doesn't take very much to get a new laser approved by the Food and Drug Administration and to get something out to market. And unfortunately, many of the complications that we see from either surgical procedures, from lasers, and from injectables don't show up until you have tens of thousands of people over time using a particular product or a particular laser. Things that we offer in all of our venues are going to be significantly tested and mainstream. And people call me all the time and they've seen a recent editorial in the newspaper or in a magazine or on Oprah Winfrey, and they ask me, do I offer it? And the answer is often no. That might lead one to believe that we're not up with the times, but the truth is we're there for your protection. We are here to serve as a buffer for our patients to protect you from things that are really not clinically tested. My advice to most people is let somebody else be the guinea pigs, not you. So that being said, I want to take you through some of the things that we do and some of the offerings that we have which are really meaningful. Botox is a great example. Botox or botulinum toxin is something that we do to get rid of fine lines and wrinkles. It is a wonderful procedure which has been used for decades, for literally for many purposes, but more recently for aesthetics. It commonly will get rid of what we call dynamic wrinkles. Dynamic wrinkles are those furrows which occur when you furrow your brow, and I can't get Botox or else I couldn't demonstrate that, and the crinkles in the corner of your eyes when you smile, or even the forehead lines that are horizontally oriented on your face. Some people who are smokers will have vertical lines around their mouth, and even some people further will have platysma bands or the vertical bands on their neck, which we wish to get rid of. Botox works extremely well. It's a small, nearly painless local injection, which typically does not require any anesthesia, and the effects of Botox last anywhere from 3 to 4 months. The good news is that if you don't like it, it goes away. Bad news is it goes away, and you have to repeat it every 3 to 4 months. In In the environment of our medical spa, it's pretty easy to get in and out and get the Botox, and people come in on their lunch hour literally to get it done with little or no side effects and no downtime. The other very, very commonly done procedure is what we consider as a global or a group of things called fillers. Fillers are products which are injected into static wrinkles or lines which don't go away when you are relaxing your face. Examples of which are nasolabial folds, or the lines here, the marionette lines which occur over here. And sometimes if you have very deep furrows in your forehead or other places on your face, such as scars that don't go away, you can fill those holes out very effectively. Fillers have come a long way over the last decade or so. Most people are familiar with collagen. Collagen started out approximately a decade ago from cow sources and then became much more commonly used from human sources. And now we've almost completely gotten away from using collagen of any variety because unfortunately it requires skin testing due to many people's allergic responses, and also didn't last very long. The most common fillers now are a group of products called hyaluronic acid. Many of you have heard of companies called Medicis, which makes Restylane, which is one of the first and very popular fillers, and now Juvederm and Perlane. These products are a grouping of hyaluronic acids which are lasting longer and longer. In fact, most of the hyaluronic acid products that are used now, which are used to fill the lips, to plump up your lips or nasolabial folds, are lasting 6 to 9 months. Oftentimes we'll use either a topical or an injectable anesthetic because it hurts a little bit more than Botox does, and that can be done also on your lunch hour. The good news is they go away, and the bad news is it goes away. There are a little bit more longer term fillers, such as hydroxyapatite, Radius, or also known as Radiance, and this is a product which will last approximately 1 to 2 years, has a little bit more downside risk based upon the fact that it doesn't go away and it can be a little bit more lumpy. And there are lactic acid fillers which are also used to help plump up your cheeks. All of these fillers are commonly offered in our medical spas and are extremely popular and extremely effective, and most importantly very safe. Any problems with them are minimal, the reactions are very limited, mild asymmetries and bruising can be seen but are usually very self-limiting. The medical spa environment is also a common place where people get either light or laser care. There are two different kinds of light sources. One is a pure light source, which is known as a laser, and the other is a multi-spectrum light source, such as the sun, which has many different kinds of wavelengths that are coming out. And simple filters are used to select the wavelength that is most appropriate for the individuals. Light therapies are also broken down into what we call ablative and non-ablative light therapies. The ablative therapies are typically done for resurfacing, such as removing fine lines or wrinkles or acne scars. The ablative lasers are typically carbon dioxide and erbium YAG. The erbium YAG and the carbon dioxide can be used in 3 different ways. They can be used superficially, where you're taking off a very small outer layer of your skin, such as in a micro laser peel, which is almost a lunchtime procedure, or perhaps a day or two of downtime at most. It can be fraxel or pixel, depending upon whether the source is erbium or carbon dioxide, and that creates a pixelated approach to the laser application. What that means in English is that you're going to lay down dots of the laser at approximately 10 to 30% of your total skin area, which heals much more rapidly than if you're ablating or burning the entire skin surface, but it has to be repeated. And the third way to apply a laser that's ablative is to take off the entire outer layer deeply, and that typically requires an anesthesia and not done in a medical spa environment. The non-ablative lasers, I think, are where most of the research and most of the progress has come over the last decade. The non-ablative lasers will help stimulate your collagen and elastin, which are the proteins in your skin, which, when stimulated, will reduce the fine lines and wrinkles and tighten your pores, as well as improve your overall skin tone. Really, the state of the art in skincare now is to combine home skincare with a minimally invasive ablative laser, such as the microlaser erbium peel, and combine that with the deeper stimulating lasers, such as the IPL machines that we use in our medical spas, and we use a platform from Cyton Corporation, a product which I'm very happy with. Further, lasers are used for treatment of capillaries, spider veins on your legs, and of course, laser hair removal. When you combine this full gamut of laser and light therapies, it's truly remarkable what you can achieve with very little downtime. We even have another machine which turns off collagenase, which is the enzyme which breaks collagen down. So our goal then is to not only stimulate your collagen production in your body to reduce fine lines and wrinkles, but also to prevent the collagen from being broken down. When you combine that with skincare and perhaps a chemical peel, the products that are offered along with Botox and fillers, which we just discussed, produce an enormous variety of very fine services which produce significant improvements for people. Can you find a facelift in a medical spa? No. Can you get significant improvement now? Absolutely. And it's worth looking into, both here or abroad. I would suggest you go to Papillon MediSpa website or beyondmedispa.com in the UK and to look at our offerings, because the offerings are truly unique, truly vetted, truly useful, and I think are going to be helpful for most people, particularly between the ages of 20 and 60, where the medical spa services are often most valuable. Thank you for joining me on this spot, and if you have any more questions, please don't hesitate to email me, bcohen@totalskincare.com, and I'm happy to answer any specific questions that you have about our services. Thank you.